and Opportunity Learning Lab. This learning lab is a joint initiative by Andy South Asia and East and Southeast Asia chapters to make entrepreneurial spaces more inclusive. I'm Vinitha Venugopal from Andy South Asia, and I co-lead this learning lab with my colleague Bob from Andy East and Southeast Asia. The topic of today's session is exploring intersectionality and designing inclusive programs. This is the first part of a three-part series. Today's facilitators are Shamha Nasir, who works at UNDP's Bangkok Regional Hub as the gender specialist for the youth empowerment portfolio in Asia and the Pacific. Previously, she worked with the regional gender portfolio at UNDP's Bangkok Regional Hub, focusing on gender transformative programmatic approaches. And the next speaker is Ian Jones. Ian is a founder of several ventures, including Agile Development Group, an entrepreneur support organization for women entrepreneurs living with disabilities, and Mekong Inclusive Ventures, an ESO that trains impact entrepreneurs in Cambodia while developing their own disability-friendly ventures. As director of Red Hat Impact, Ian leads efforts to provide uncollateralized patient and syndicated impact debt, aiming to fix the capital, not the founders. On behalf of the Learning Lab, I would also like to thank Vinaya from Inclusa, Tom Sebastian from Seed Stars, and Nirmida from Selco Foundation for co-designing this session, along with Ian and Shambha. Now, I will just briefly share some housekeeping rules, and then we'll pass it to the facilitators. Ian, if you could go to the next slide. Yeah, forgot. For those who don't know, I'm guessing most of you are familiar with Andy. Andy stands for Aspen Network of Development Entrepreneurs. We are a global network of entrepreneur support organizations, including accelerators, incubators, investors, and other research organizations. If you can go to the next slide, Ian. Yeah, we request you all to change your Zoom name to name, pronoun, and organization. And if you have difficulty following the speakers, please turn on Zoom captions. You can find the captions CC and then choose the preferred language, or you can just set it to English itself. And we will also be shortly sharing an anonymous participation document that you can use if you are not comfortable with verbal participation. You can also share any messages in the chat. And the session in this main room, this is being recorded. If at any point of time you do not want the recording to pause, please let us know. And please let me and Pop know for any support. Hope you will all enjoy the session as much as we enjoyed putting it together. And over to you, Shanta.
Thank you, Vinitha. Good afternoon, everyone. Thank you so much for joining the session today. I hope this will be an informative session for you, and I hope together with Ian, we'll be able to have some rich discussions and identify some practical solutions for how we can bring in a stronger intersectional perspective to the work that we do. Next slide. So before we go into the concepts and theoretical framework, I thought it would be good to start with a quick exercise just to get us going. So the question is, who are you? So can you please in the chat box just describe 3 words that describes your identity? Of course, we have multiple identities. For the purpose of this exercise, please kindly use the chat box and tell us the 3 identity characteristics that makes you who you are. You can take a few minutes. We have one mom, woman, passionate person. We've got funny, loud, and strong. We've got leader, feminist, or community builder. Maybe one more. We've got mother, entrepreneur, friend, dynamic. Next slide, Ian, please. So now as we look through the responses, we can see some unique characteristics that you identify with. And also as we look at the responses, we can also see what very common identities across our participants as well. One being a woman, a community champion, advocate, feminist. So as we go through, it's also then once you have now identified the three characteristics that makes you who you are, then also I ask you to think about one is which of these identities give you privilege and power in certain settings, and two is which ones create barriers or make you feel invisible. So you can just write the number one and the identity, and number two and the identity characteristics. So this is also just to get through thinking. So we've identified different identities that make us who we are. But then unpacking that further, which of these identities makes us have more access and opportunity, and which of these identities really feel like it's more of a limitation for us? Women to both. So please keep thinking along these lines. But this exercise is actually to help us recognize that we all carry multiple identities, and this really influences how we experience power, opportunity, and also how we encounter barriers. Yeah, and as we can see from the responses, there are similar identities, but our experience can still be different due to how these identities intersect with each other. So today, I hope through the presentation by myself and Ian, we'll be able to explore this complexity through the concept of intersectionality and see how overlapping identities creates layered discrimination and sometimes even hidden barriers. Next slide. So now let's dive into the concept of intersectionality. What is intersectionality? So it's not just a theory, but it's a useful tool to help us support individuals, groups who are often most excluded. It's a way of understanding how different aspects of a person's identity, like their gender, disability, age, ethnicity, or geographical location, can interact to create unique experiences of advantage or disadvantage. And it's also the acknowledgement that these identities don't exist in silos, they overlap. And once they overlap, for certain individuals and groups, they can create heightened barriers and can intensify the exclusion that they face in ways that a single identity barrier may not. So if you look at some of the data in the Asia Pacific region, we have over 400 million persons with disabilities living in this region, many of them women and girls. And these women already face a series of obstacles due to their gender. But when you incorporate disability, their geographical location and age, these barriers continue to multiply. So a young woman with a disability from a rural village isn't navigating just one challenge. She's facing multiple compounding forms of exclusion, for example, inaccessible transport, cultural stigma, maybe, and a lack of support systems and networks that really prevents her full participation and leadership in social, economic, and political sphere. So for us, intersectionality is actually a lens to ask the questions continuously. Who is being left out? whose needs are not being met, and how do we build that support that really captures the lived reality of individuals and groups. Next slide. So why should this matter? Why should intersectionality matter for us? Many programs focus on a single focus. So it can be programs or services focusing on youth or persons with disability or even young women. But we miss out on those those identities that might be intersecting. For example, women with disabilities who face more complex barriers, as I mentioned. So they are often excluded because these programs doesn't take into account the heightened barriers that these individuals or groups may face when these social identities intersect, and they're not able to access these opportunities, and they're not able to participate in a meaningful way. So again, just to highlight some of the evidence and data from the region, there's a report by UN ESCAP that says the persons with disabilities are approximately 2 to 3 times less likely to be employed than persons without a disability in the region. And women with disabilities are only half as likely as men with disabilities to find a job. So it's not about their identity as gender alone or another identity, but it's about, as I mentioned, how they intersect and deepen exclusion. And we have data and evidence both at the regional level and at the country context really showing that there are individuals that have been left behind because programs and services are not co-designed to accommodate their lived realities. So it's very important to ask who is missing from our outreach and who is silently opting out because the program was not designed for them. It's also about thinking through, so we understand now how different identities can intersect. Then it's also thinking about once they interact across these systems of power, like patriarchy, ageism, and racism, how they overlap and reinforce discrimination, inequality, and exclusion. So, and then these systems actually create visible and invisible barriers that stop people from fully participating, even though at times we say the program is open to all. Just a hypothetical example, a young woman with disabilities in the Pacific may face a chain series of exclusion, and they're all interlinked. For example, due to lack of accessible transport, she may not be able to go to trainings that provide skilling on entrepreneurship. No training means she has limited skills to establish and scale her enterprise. She might not have a viable product that is where she's able to request for loans or grants. So it's about how these series of barriers actually create a cascade of systematic barriers that prevent individuals from pursuing their entrepreneurship ambition in this case. Or we can even think about policies that may seem neutral, but actually doesn't take into account the gendered barriers, for example, in gaining employment. We can also think about grants or loans that has as a requirement proof of employment, education. These may exclude young women with disabilities who may never have had formal work or education opportunities. It wasn't intentional, but it is exclusionary because, again, we didn't take into account the diversity of people within communities and the different types of barriers that these individuals and groups face when their identities interact. Barriers can also be structural. So as I mentioned, inaccessible application forms for grants, trainings, physical spaces. Also, it can come in the form of behavior or attitudinal. So it may not be visible per se, but it can be to do with our biases, conscious or unconscious, around who can actually be a successful entrepreneur. It can be around a successful entrepreneur will need to work full time. They cannot have caregiving responsibilities. So this is where we also need to consciously work towards addressing some invisible barriers and unconscious bias that may be prevalent across the ecosystem stakeholders as well. Next slide. Individuals, as I mentioned, so what do we mean by understanding intersectionality in practice? So individuals experience discrimination not in isolation, but through interaction of multiple identities. And it's not just multiple barriers being stacked up, but it's also understanding the way that they interact and how they create unique barriers and often invisible barriers. So you can have a young woman with hearing impairment from an indigenous community, and she may face gender discrimination in a male-dominated business culture in terms of the investors that she interacts with. Entrepreneurship support programs could be inaccessible, whether it be through the modality of delivery or the application process. You could have linguistic and cultural exclusion in national levels in terms of, again, funding opportunities, the language that is being used on application forms. So we can see through this example that her barriers are not individual or separate, but they combine to form unique barriers that is based on her lived reality. And that's why we cannot have a program that doesn't take into account these intersectional factors. Again, we need to continuously ask ourselves from design, delivery to evaluation, who is actually missing from our program and what overlapping barriers are they continuing to face, and how can we design support that fits the whole complex and reality of their lives. So to be truly inclusive, we need to step back and see the full picture to see how different barriers actually overlap. Next slide. I also wanted to acknowledge, and I'm conscious of time, so I won't go through it in too much detail, but I also wanted to touch upon some of the challenges that we have at the moment in integrating an intersectional lens. While, of course, we intentionally move towards intersectional programming. So limited representation, we are seeing across the board, across different ecosystems, that persons with disabilities, especially women with disabilities, are rarely included in leadership roles, whether it be for policy or program design, whether it be in decision-making processes at different stakeholders. This lack of voice means that program often miss key insights. They're not able to bring in diverse perspective to make their program or services truly inclusive. I've touched upon this also. One-dimensional policies and programs is not really targeting the most that are left behind, and it also risks leaving behind those at the intersection of these different identities. Inflexible systems and structures, again, I have touched upon it. These requirements around educational criteria, inaccessible formats, can unintentionally even exclude people. So imagine having a pitch competition and the criteria being the submission of a written proposal only. So even though this is not intentional, it can still continue to exclude certain individuals and groups. There is, of course, challenges in collecting data, but it's very important, to collect disaggregated data by gender, age, geographical location. But the second step is also very important. Once you have this data, you have to analyze it through an intersectional lens. So again, the analysis should not be silo within these characteristics, but really try and understand, okay, once these identity factors interact, then what are some of the key insights that have been generated once you have collected this data. Cultural and social norms can prevent and limit participation of individuals and groups. For example, still in some communities, Disability, persons with disability is stigmatized, women's mobility is restricted. These intersecting norms also shape who is able or safe to take entrepreneurship risks or able to pursue entrepreneurship opportunities. Oversimplification. Intersectionality is a very complex issue. We acknowledge that. It's also about understanding how the power structures shape lived realities of individuals. And I think the first step is sessions like this, having that space for discussion and taking intentional steps to make sure you bring in an intersectional lens. Next slide. So I also wanted to touch on some of the work that's been done by my organization UN on identifying maybe some of the key entry points for intersectional programming. And this is more just enablers, and it's up to us to adapt it to the context that we work in. The first one is around, as I mentioned, it's an ongoing process of self-assessment as we design and deliver programs. So as individuals, we need to be aware of our own biases and how our position of power can shape our decisions, the programs we design, and the type of skilling we provide. So for example, when we are designing an entrepreneurship program, I think it's very important to ask whose voices are we centering, who might be left behind or marginalized. Dignity, choice, and autonomy. It's very important to respect and uphold the dignity, choice, and autonomy of all people. So every individual has the right to make decisions about their own life. For example, this can mean providing entrepreneurship with informed choices and options and respecting their choice to choose the entrepreneurship journey that they would like to pursue. Universal design, I'm sure many of you are familiar with the concept. Again, building programs that are accessible to everyone from the very beginning. So how can you have a diverse team that will ensure that your designing process is inclusive from the very beginning? It's also about asking people what they need to participate. Also thinking through, have you removed the physical barriers? Are there any transportation barriers or even communication barriers that is limiting some people from even gaining information that these services and training opportunities are available? The fourth one is again on, as I mentioned, diverse knowledge. It's very important to have a diverse team that is able to co-design initiatives with you. So community consultation is important. Ensuring that there is a diverse talent pool within your organization is important. And it's also thinking through how can you embed a diverse team within your team that will continuously allow to assess your program. Relational power is another key enabler. So being conscious of the power dynamics in the relationship you're building within your organization, we are working to create equitable partnerships so that everyone has a voice and influence, fostering collaboration. So it's dismantling power dynamics is very critical for transformative and lasting change. So this is a critical area that we are also now currently working on to ensure that the most marginalized individuals and groups are engaged. Time and space. So meaningful inclusion requires time and space. It's also understanding that nothing is static. Privileged and disadvantaged disadvantages are fluid, and it can be influenced by our social positioning or location. So for example, privilege may look very different in one location from another. It may look very different from across different generations. At the same time, discrimination can look very different from one country to the other. It can be different across generation as well. So being very mindful that when you're designing programs and services at the national level or through a regional initiative, just co-curating it so that it's relevant to the country context. Next slide. Just wanted to capture key points before I wrapped up, but just wanted to highlight, I think it's very important to acknowledge that intersectionality can be a helpful tool for all of us to really understand and get a nuanced understanding around how people's overlapping identities can profoundly shape their access to resources and opportunities, and how that can vary from context to context. There's no one size fits approach, so it's very important to have a program or initiative service that is adaptable and continues to be adaptable to the evolving context and to the needs of, for example, young entrepreneurs that you are engaging with. Building truly inclusive entrepreneurship ecosystem demands intentionality and flexibility. So as I mentioned, it's about starting with the right intention, designing practical small actions that will really help your organization, your program move towards a intersectional and inclusive program. And this will take time. And finally, and perhaps the most important one, is we need to collectively work together to redesign the systems. We need to redesign policies, practices, and structures so that we're able to center equity, dignity, and justice at the core of all our work. And only then can we really move towards transformative and lasting change, and can we really ensure that no one is left behind, and we are able to cater solutions that helps the most marginalized individuals and groups dismantle the barriers that they are facing, so that they are able to meaningfully participate in the different economic and social sphere. Thank you. Next slide. I am quite aware that was quite a lot of concepts to digest, and I have tried as much as possible just to make it bite-sized. But as I mentioned in the last slide, it's about understanding that individuals have their own lived reality, and in turn their own unique barriers, and how can we really work towards supporting them to realize their ambitions. So it would be great to hear from participants here today. I'll break it down to two. Given the time constraint, I thought it would be best just to have an open discussion. So feel free to write in the chat, unmute yourself, just to share with you. I touched upon a couple of challenges, but it will be great to hear from you. What are the challenges that you are encountering when trying to make your programs more inclusive? Just so that through the rest of the session as well, we can try and unpack that further. And we of course have the session 2, where it would allow us to unpack maybe some of these identified points further as well. So it would be great to hear from colleagues, just sharing your own experiences and insights. Feel free to raise your hand as well. We've got one, budget challenges. Sometimes it costs more to be inclusive. Very true. And in another session also, there was a discussion around how, when we talk about an ecosystem transformative shift, we also need to advocate with our investors and donors around the impact of having an inclusive program. And how that's going to result more inclusivity and sustainable results in the community. I think I saw one hand, maybe.
Yeah, that's
Mehul. Yeah.
Yeah. Hello, everyone. This is Mehul. I'm from Multiply, India. So when we started, so the aim was to employ persons with disability in our organization. So the challenge was that we're not getting, so we talked to many NGOs, okay, who are into this space, providing employment, and Enable India was one of them, and the many other NGOs whom we approached. The problem was that we're not getting people. In fact, no, they were filtering the CVs at their end. So So then that was a challenge that we wanted to be. So our aim is that no making fashion for PWDs by PWDs. So the challenge was to get people on board. Then we realized that no, why are we expecting no them to come to us? Why can't we go there? So how we overcome was that we approached few colleges, okay, who special colleges where they teach to persons with disability through Enable India. Enable India is one of the organization. We approached the college. We uh, got some interns. We tried to tap in from right from the college. We got some interns. We trained them, and then hopefully in a month or so they're going to join us. Yeah, so there was a challenge getting people on board. That was our own. We thought we'll get people instead of we going to them, and then we change our strategy. Let's train people. We went to the college. We got freshers. Yeah, there were problems, challenges in terms of training them because the sign language was the first language. We actually trained a person with hearing impairment. So the challenge was that the sign language was the first language, not even the regional language or English. But then we had to tweak our own training methods. And then, yeah, we thought we'll cover this much to train them, but yeah, we were short of that, but still we have time to again, impart more training to them. So that I think it's a long journey to be inclusive. It's not a short time, or quick fix. And yeah, we are committed to it. Thank you.
Thank you for sharing your experience, and I think you ended it on the right note. It will take time, but the important thing is to be intentional with our action and to learn and to continuously adapt so that we can move towards being more inclusive. I see there are other insights as well. Maybe can I ask colleagues to unmute yourself and share? Maybe Dennis?
Sure. I will have to keep my camera off because my internet's pretty dodgy in my mom's home. But yeah, I think that was just something that was very curious to me. So we do a lot of work with our community of women entrepreneurs. And we do a lot of events as a result of that, kind of having more understanding with them wanting to access more networks, things like that. So part of obviously running an event would be to run registration forms, but also feedback forms at the end to try and capture more of this data. And because we do have a clear gender strategy, we are mindful of I guess like wanting to capture sex and gender disaggregated data at all points whenever we're able to. And I just thought it was very curious that whenever we would run events, majority of our respondents would opt for the option that says prefer not to say when we ask them what their pronouns are, when we ask them how they identify as. Because generally when you run these surveys, you always kind of have that option, right? And that's really to kind of make sure that, they're as comfortable as they are when they actually give you that information. So that was obviously a clear or like a deliberate option that was put there by us. That being said, I just thought it was curious that, they would opt for that. And therefore that doesn't actually give us the gender disaggregated data, I guess, that we were, maybe hoping to kind of surface from these sorts of surveys. Obviously, that's just one example, but I just thought it was something that was interesting to note. Yeah, so I did just kind of want to share that.
Thank you for sharing that. I mean, just to again add to say this is something that we have come across as well, and I think it could be to do with country context, cultural norms that may prevent individuals, but we can only work with the data that we have while we are working towards that macro view of advocacy and dismantling gender social norms, behavioral barriers that may actually be driving what you are saying, that might, because now the question is to ask ourselves is why is this data missing? And I think it's great you raised it, and I think it's important to keep questioning. We might be able to identify a driver of this, and hopefully you can work within your community to address that. Again, I see a great point of when we talk about persons with disability, also to encompass the diversity within this group as well. And again, what does that mean in the context of the programs we offer, and in the context of the resources we are able to mobilize to make the programs more inclusive as well. So thank you for sharing this great insight. There is one comment. Yes, across the board, we are currently in a unfortunate external environment. It's continuously evolving, and it's having an impact globally across all organizations, from the grassroots to the at the regional and international level. And just to say, I think this is where partnerships like this and collaboration come in to really help us continue this agenda forward, and leaning on each other despite the limited resources to really have those spaces for conversations like this, and to see how we can integrate it into other areas of work that we are continuing to do. Ian, would you like to come in?
Yeah, definitely. I think just before to start mine, and we talk about compound barriers, I think, just to highlight when you talk about intentionality, absolutely, and collaboration. Now, I just want to make a very clear point here that impact is a two-way street in a way, right? Whilst many are beholden to the funders and the foundations, there's no improvement if it's not a two-way street. So if you don't get disaggregated data, that's okay. Because if you have an issue from a funder that says, why are only 77% of your participants choosing to select how they identify themselves, I would say, well, you pick up the phone, you call them, you ask them how they choose to identify, because the whole point of self-identification and disclosure is about choice. Now, this is something I learned very early working in mental health. The disclosure is up to the person. If a foundation needs metrics, they're not the foundation that you should be working for. It is our role to educate them to improve. Otherwise, things will never change. So on that note, let's talk about happy things like compound barriers. As I am a little bit of not tech savvy whenever I'm on here, this should bring, hopefully, the screen up for you. Now, Suchi, you have your hand up?
Yes, while you're bringing the screen up, Ian, just to your last point about disaggregated data. I think till date, even if we just talk about the gender as a binary, it wasn't captured. Something you would think that collecting in the binary disaggregated gender data should have been covered by now. We've been shouting from the rooftops for at least a decade now, right, Ian? Correct me if I'm wrong.
Yeah.
And
yeah.
it still does not happen consistently across all levels in all of the countries that are represented here today. So just wanted to make that point to Mehul's as well, which is it's a long, hard battle. And I think, that's not to say that we shouldn't keep chipping away, but just to put things in context, it seems simple, it seems intuitive, it seems like it should be easy to do, and yet it's not.
Yeah, yep, absolutely. And thanks actually you can see the screen now, I hope. I'm not particularly Zoom savvy. Vanita, that's all good?
Yes, Ian, can see.
Okay, cool. One of the things that, I like to start these conversations with is that we can't do all of the things all of the time for everyone. And I think this is where a lot of, professionals, people, practitioners get stuck, is that when you look at disability inclusion, it very quickly becomes complex, or it seems complex. When you look at the theoretical background, and I say theoretical because if you want to go and look at UN documents on intersectionality, as we talk at Shama, they're like 30 to 40 pages long. All of a sudden, it seems very complex. But in reality, it doesn't have to be. Quite often, a lot of the work that you're already doing covers multiple compound barriers. And I think for me, I realized that I've been doing this for a long time, and it was only now when we do access and opportunity learning labs that I realized, oh, there's actually a language for this. Now, doesn't quite put me in a huge shining light, but what I want to get across to people is in a lot of your work, even just being human and have empathy, you're probably already identifying where there are compound barriers. Now, when we look at it, we talk about, is it disability? Does it have, let's say, a physical barrier, an attitudinal barrier, a financial barrier to participating in entrepreneurship programs? So when we look at compound barriers, we're talking about 2 or more identity-based barriers when they interact. So it's more than just about adding 1 + 1. What we see here is very unpredictable hurdles. So to give you an example, International Committee for the Red Cross were supporting people with disabilities in rural areas of northern Cambodia. But the only problem was getting them to a health service was very difficult, and then even more difficult in the rainy season when you're talking about full-size cars getting through the mud. So one of the things that they employed us to do was actually to convert a 3-wheeled tuk-tuk, the moto with the trailer, to be physically accessible. Now, the reason for that was it added to their fleet per se, in the sense that during the dry season, they could take a van that was outfitted to be a mobile repair unit for wheelchairs and prosthetics, which we also designed and outfitted, or they could also go and collect people with disabilities from the village in a much lighter motorcycle-driven tuk-tuk. So when you take this creative design, it's not hard to look at, okay, where are the barriers? How are we providing a service delivery? Now, I want to frame that because not all of us are just in entrepreneurship. But it's a very good example to talk about the tyranny of distance and the compounding barriers. So when we put that into our work at MIV and Agile, the first thing we ask, and the reason I'm giving you this sort of intro, how much does it cost a woman entrepreneur with a disability to, 1, give up her time in her employment, self-employment, and how much does it cost them to come and participate in a program that our funders also would like to run? Now, we've had to advocate very strongly to include that in our budgets. And again, we say the same thing to the funders. This is what it costs for participation. If you want to call someone and tell them that they can't participate because they can't afford $4 a day for a 2-way tuk-tuk because of mobility issues, go ahead. And very soon it changes their attitude, like, oh, okay, this is a cost that has to be borne by us. So for us, it's constantly just educating the system and the ecosystem around compound barriers. So when we talk about this very quickly, when you look at job training programs in this regard, if it's a single mother, then we can make an assumption and you check it when you do a needs assessment. Okay, who's looking after the children? So when you look at, you can't just ask someone, all right, I need you to fill in a Google sheet that doesn't give any additional questions. Like when we do phone calls for needs assessment, we talk about family. We talk about, is there someone to look after your children? And if there's not, quite often we locate our trainings in a rural primary school and parents are able to bring their children to the training. Okay, so when we look at unique barriers, you're talking about mobility, you're talking about family. So through this journey today, we're actually going to just look at 3 sort of personas to allow you to look at this spread. So the great thing about the Access and Opportunity Learning Lab is we're now moving beyond just disability inclusion. And we're looking at, okay, how can we tackle this on a systemic approach? Because as you heard, universal design, designing for all, actually captures a lot more than just whether it's disability inclusive or working with women entrepreneurs or working with refugees, as we're about to see. It provides much better access from all. So we're going to look at Maya, the single mother, 40 kilometers from nearest employment, has 2 young children, and faces barriers that don't exist for urban women. And so this is where empathy begins. If you're very used to running urban incubators, then you need to take a step back and look at, okay, what is peri-urban? What does rural incubation programs mean? How much additional does that cost us to add in things like accessible hotels in rural areas? The second one we want to look at, and definitely here because mental health is quite often a hidden disability. Now, people with severe anxiety at times can struggle to leave the house. People with severe mental health episodes, like schizophrenia, sometimes struggle to even get the confidence to move into society themselves. And we're probably all very aware of the stigmas that have come to that, which is why we've also looked at Ahmed, fled conflict, struggling with depression and anxiety, and how the community views mental health treatment. Now, this is really important because in a lot of communities, there's not even sufficient language around mental health and mental illness as a hidden disability. So here we're talking about the compound nature of the isolation around this. The third one we want to look at is a teenager who's transgender in the foster care system. Now, this one for me resonates because before I moved to Cambodia, I actually volunteered for Melbourne City Mission. Now, what that meant as a volunteer was I actually lived in a full residential house with teenagers who were about to age out of the care system. So they moved from full care, being locked in at night basically, to living with me and another lead tenant, to then being kicked out of the system at age 18. So this is actually an excellent sort of case study to look at of when things get cut off immediately and what's the impact of that too. But in terms of Alex as transgender, we're looking at identity, independence, and safety also here. So as we move through this, these slides are available. So when we talk about why they matter, it's so much easier just to serve the easiest to reach groups. It's in our comfort zone. We know them. They're on our mailers. They come in through our donors and funders. Now, quite often, unfortunately, it means the same people come to the same trainings because they're the ones that don't have compound barriers. They're the ones with access to Facebook or their emails. But it also means that what it means is you might successfully serve the amount of clients or the indicators that you need. But when you're talking about people like Ahmed, who may have moved to a country, may not have technology, they can't afford it, there may be a stigma around their mental health. Now, whether it's a program, whether it's a service, they're not going to be served without actually having the intent that Shama talked about. So what it means is you think about how much waste is occurring on ineffective solutions when we're just focusing on throughput. Now, when you look at a reasonable accommodation, and we'll talk about this more, if you spend $50,000 on English language marketing and scheduled therapy, which happen to be during prayer times because you haven't asked people on an application after you've reached them, what are your requirements? And you only require online intake forms, then you're probably systematically excluding those who need this the most. So in this, there's actually quite very simple ways to overcome these barriers too. So I'm just checking the chats here. Yep. Thanks very much. So let's look at the 3 key barrier domains. Now, a lot of us would be familiar with this. Definitely for disability inclusion, when you talk about access barriers, we're talking about a physical, the built environment, the digital barriers, the web accessibility guidelines are fantastic. We talked about that in the previous learning lab, of which Andy can show you the slides. But the stigma barriers. Now, we know through our work with women entrepreneurs with disabilities, there's a lot of money that goes into banking and financing women entrepreneurs, but it doesn't go into cultural change in the banks who refuse a loan to a woman purely because they have a disability. So we look at that, but then we start to look at systemic barriers, policy gaps, and siloed services. Now, definitely this exists in a lot of countries I've worked in, but also in Australia too, where we think of it as a developed nation and we've got all of our things together. But what it means is when they face barriers in areas simultaneously, the impact multiplies. It's not like, oh, it's just one thing plus another. So when we talk about Ahmed again, we're talking about, okay, you can't afford a bus fare to the mental health clinic. And this is stuff I was working on 15 years ago, and people still don't overcome it. And the clinic has no Arabic interpreter, okay? So this is where you start to see them come together. The stigma around the refugee community believes mental health treatment threatens immigration status. They're worried they could be halfway through a refugee visa and they don't want to upset the apple cart or upset the system. So then they're not applying, and then the healthcare staff dismiss the symptoms as well. It's just cultural. And then once again, when we look at systems, appointment bookings require online. Now, to go back to the comment, if we're putting in support services, community community workers that support refugees like Ahmed, yes, it's going to cost more. But also when we ask this and you look at, let's say, being a bit drier for return on investment, what's going to cost less? Building systems in the design stage so it provides more access to all, or trying to retrofit it, or if someone needs more medication, which means they're more reliant on the healthcare system, which takes up times for hospitals, nurses, doctors, support workers. So when you look at a social return on investment, using universal design, using systems-based approaches for change makes financial sense too. So here I'll just talk through some of these more quickly just so for time. We've got Alex, transgender teenager, looking for emergency shelter, but youth services say they're too old. This is a systems barrier, but adult shelters refuse transgender clients as a stigma barrier. Now, in Australia, in the work I've done, this stigma barrier is not so bad. But consider what's happening in the United States right now. People will be less inclined to even identify as same-sex, let alone transgender, because what the backlash is now occurring in society there. So the reason why I've placed this here now, the young person I work with wasn't transgender, but when you talk about aging out, you need to be empathic and look at what's the experience of the person that's going through this process. Now, for this young woman and also a young man that were living in the house with me, they get really scared at the age of 17 and a half, and definitely at 17 and 3/4, because the Australian system at 18 says, you're an adult. There's no free healthcare. There's no free dental care. There's no free housing. Now, quite often, the way that they're going to express that pain is going back into either homelessness or crime. So being able to look at this from the start and looking at systemic barriers allows change for a much bigger portion of society as well. So then we look at the consequences of neglect. So we talked a little bit about that in the last slide, but we see low uptake, right? So when we first started designing programs for women entrepreneurs with disabilities, they're very uncomfortable applying because no one had ever actually reached out and said, no, we're designing this for you. So it allows, you need to build up trust, because for them, whether it's national, state, local government, quite often they're overlooked. And there's many horror stories in Cambodia that we don't need to get into around that. But embeds a widening inequality gap because they're not accessing services, not accessing health, they're not accessing financial supports. So while some solutions work for some, they systematically exclude others. So the consequences of not looking at systemic change is much bigger than designing for it. So in this case, they're talking about a program designed for at-risk youth, has a 60% dropout rate and poor outcomes. But the organization doesn't track the intersectional data. So it means that if transgender youth like Alex were never felt safe to be in a place, never felt safe to share, then they're most likely not going to apply. Now, this can come back to even then when you look at your program design and your marketing and communications, particularly around looking at gender lens, what's happening with your imagery? What's happening with your language when you do this? Now, what's really interesting in Victoria before I moved to Cambodia, they actually redesigned a youth health center with youth so it'll make it more comfortable, because when you think about medical clinics, they're very cold places, right? Now, you want youth to come and engage with the local council to support them. what they did was actually had an integrated smoking area in the middle of the clinic as an outdoor area. Now, the reason for that was in Victoria, my state, has a very strong anti-smoking approach, but they realized that for youth to feel comfortable, they wanted to go outside and have a cigarette when they were stressed. So they designed the built environment around that. So again, it's not overly complex. It's about empathy and intentionality, as Shama was talking about. So I'll stop talking for a second. And what we're going to talk about in a breakout is which barrier domain intersection is most urgent for your work. In this, we'll discuss in small groups. Now, you don't need to achieve all three. This is just a starter point. Which two identities in your context overlap? Or in which domain does that intersection hit the hardest? Now, we'll talk about this at the end as well, but what is the one small immediate change you could test to ease that compound barrier? So I'm going to hand it back over to the Andy team now.
Thanks, Ian. Give me a minute when I am adding people to the breakout room.
As always, feel free to keep adding questions and insights to the chat. We'll be able to check these later, and that provides us with a wonderful feedback loop to help us design the second session. Now, the way that Andy designed these learning sessions is that we start off with very much a practical introduction session, not to overwhelm people to get a step onto the ladder of looking at intersectionality. And then what we tend to do is then work into a much deeper dive in the second session. And if there's a large demand, we will run a third session, which takes an even more deeper dive into specific areas. So please vote with your fingers in the chat, or please send a message to the Andy team about what you're looking for these learning sessions.
Hi, we are going to open the rooms now. Ian, if you can join room 1, and Shamha,
Yep.
if you can join room 2, that will be great. Also, to capture the discussions happening in the room, you can share your inputs on the participation doc. Pop will join room 1 and I will join room 2, and we will act as scribes. Opening the rooms now. Breakout time is 10 minutes. So request you all to come back. If you need more time, just message.
The joys. So just to finish the sentence that we had in the previous room is that there are many cost-effective or no-cost ways to be inclusive. And looking at forms, you want to make sure that if you're using forms or if you're getting someone to call a participant, adding in some additional questions around, do they self-identify as having an impairment type? And there's a lot of research being done onto this. It can come down to 5 questions. So, and the reason this is so important, and definitely for the work that I've experienced, is that if there's no data around inclusion and disability and impairment types, funders don't incorporate it. And it makes it really hard to push because they're like, well, show us the data. And we're saying, well, we can't because you don't include it in the capture. So about 1.5 years ago, when PACT was still active with the women entrepreneurs in Cambodia, their global head came over and it's like, what's the one thing that we could do? And so our suggestion to them was every contract you sign, just make for an event venue, just make sure that the recipient or the grantee has to make sure it's accessible. There's no particular cost to PACT. There's no particular cost to even the grantee because they're hiring a hotel anyway. But when you look at market dynamics, I can tell you when all that money starts to go to one of 3 hotels in Phnom Penh, the rest of them are going to start changing. So it's about creativity, empathy, and intentionality in how can we do this with limited budgets. But until we start getting visibility, we can't create the change. So, Suchi?
Hi, Ian. I just wanted to respond to a discussion in the other group. It's great to see a few investors here. Honestly, I think y'all are the exception. But just to a point about the narrative and the story, based on what I've seen, creating a level playing field isn't just about changing the narrative. And I'd like the investors to think about that, right? To Ian's point of change the capital, not the entrepreneur. I think as an ecosystem, we're very used to, and the reality is that it's those with the money that wield an imbalanced amount of power, right? And therefore, there is no incentive with those who control the purse strings to even want to see how they can change, right? And I think while it is
Correct.
fair that we don't pitch investment as a charity, I think it is also equally true that it is an easy cop-out to say that we're not even going to see what it takes to create that level playing field, right? There's this visual about you needing to place a higher stool for those people who to be able to create that level playing field, right? So what does it take for that delta to create it? And very often it is a need to look at it differently, and it isn't just a question of narrative. So just wanted to say that I think there is some thought that really needs to go into, okay, what do we with people with the money who control the postings and who do seem to think we have this unequal amount of power, what might we actually do to change the way that we think beyond it makes business sense? I mean, yes, of course, that's the first thing, but what else?
Yeah. No, agreed. And to be honest, in case you're on the selection committee for the annual conference, I was actually thinking about submitting for a Spark talk. Because I finally probably feel, weirdly enough, I'm brave enough to be agitating at that level to say, what does it take to make a reasonable accommodation? Like, what's stopping you? 15% of people in the world live with a disability. Over half the people in the world are women. And most of our parents are getting elderly. So when you're talking about underserviced markets, if we want to use a term, then what's seriously stopping funders, foundations, investors from shifting the needle just a little bit? And I think that's what really surprises me, just as a human being, that you can't keep hiding behind, well, this is my mandate. Or maybe that's something we need to print on T-shirts to walk around at conferences. Show me a mandate. Is it inclusive enough? But it takes all of us here to keep shifting that needle. And just to wrap this quickly, and Keisha's probably had the same problem, I had a funder absolutely berate us and drill us one year because we try and include more rural communities. And a hotel night costs $25 a night in one town and $20 a night in another town. And they're like, seriously, made us write an explanation of why the hotel prices were different. So unless this comes from the top, that to change an insane amount of bureaucracy in that level, then we're not going to see too much change. But the thing is, even having the participants in the room tonight, this is where we can start to make that change, saying, yes, running a business is hard. Running a social enterprise is harder. Running a social enterprise in rural communities and being inclusive is even harder and more costly again. You have to build in the costs for the psychosocial support, for the additional transportation. So when it comes back to companies, foundations, funders, it is time for us to say, if you are truly about impact, put your money where your mouth is. Or if not, just go to other conferences where you pat each other on the back. So, on to happier news. Let's talk about how to build inclusive programming. Now, the good news for everyone is most people are familiar with me dropping really bad pop music references as from the previous Learning Lab. The good news is that's not going to happen tonight, but we will come back to talking about how we can actually look at inclusive programming. So just a quick check, thumbs up if people are awake. Can you see this screen? All right, I've successfully achieved my live goal. Now, I always tend to, when I run a session, because if I get worried about time, I speak quicker. As you're probably familiar, I have an Australian accent. At any stage, please just put your hand up, down, or a timeout to say, look, I can't understand you at all. That's absolutely fine. Or tell me to slow down. So, because this session is for you as educators, if we're not communicating correctly, we're not doing our job. So with this, what we're now looking at is what is inclusive programming. So it's intentionally designed to work effectively for people at all identity intersections, not just those easiest to reach. Now, we did talk about this before. It's okay not to solve everything for everyone all of the time. But by taking an inclusive approaches, you will find that designing that way actually captures a lot more people. Now, for the built environment, one of the best examples is when you look at a footpath that has a smooth transition to the road. It doesn't just help wheelchair users. It helps elderly people. It helps delivery drivers. Very simple, but this is what we're talking about. So being intentional is critical in how we look at our work. So the traditional approach for average teenagers is where we talk about, okay, it's just a health center, but then they add accommodations. Now, an inclusive approach starts with talking to teenagers, like the health center I mentioned before. What do you need to feel comfortable? Is it different colors? Is it couches? Is it hangout spaces? Is it an area to smoke a cigarette? Okay, now it means that there's more inclusive approaches there. Youth feel comfortable. They're more likely to use the services. So in this case, definitely when you're talking around with Alex, the transgender youth, around mental health support. So when we talk about a reasonable accommodation, it means that there's changes that are not going to necessarily overburden you financially. Now, this is very much a term when you talk about employment of people with disabilities and people with lived experience of mental illness. But I use it regularly to talk about inclusive programming. So when you look at onboarding, and you'll see this later, is it phone calls? Is it online forms? Provide session materials in multiple formats. Audio, large print, plain language to accommodate different learning and processing needs. Now, what you might find, just doing the needs assessment might mean that you don't need to adapt your materials at all. But the fact that you've asked is the intent. So if someone says, yes, I need support, that triggers a reasonable accommodation on your behalf. Looking at flexible participation options, in-person, virtual, phone. Definitely through COVID, we all had to shift. And we spent a lot of our time phone calling women entrepreneurs with disabilities to help them set up technology on their phones for us to be able to continue the program. So it's not an insurmountable barrier. Intentionality, creativity. When we look at intersectionality here and the design, I've already mentioned this, but we're talking about designing for everyone. So when we look at employment training success in the terms of Maya, the single mother, then you look at where's the barriers, the compound barriers for her with rural plus a disability plus a single mother. So this can include remote participation options, flexible scheduling, and childcare coordination. Now, what's interesting about this is we did some work with UNICEF in Myanmar about social protection and health access to children with disabilities. And one of the ways we helped them ideate was looking at existing resources. And you look at community nurses are already working in the community. They already have trust. So if you're trying to identify the needs of children with special needs, it's far more cost effective to upskill a nurse who's already in the community to at least be that first focal point than to try and assume that a single mother can take time out to travel 2 hours into a major community centre to have her child assessed. Again, creativity, intentionality. So the adaptations improve completion rates. Now, this also then gives you better data, which you can extrapolate out into other communities as well. So it might be the reasonable accommodation is allowing extended time for the program completion, building in that buffer that women are working, have competing priorities, and providing wraparound support. So quite a lot of time, we actually have childcare on site. And I think Keisha also does the same with IDE and She investments as well. So there's a lot of examples here that you can reach out to in the Andy community to talk about intersectional design. And when we look at the three core principles, is participation is one of them. Looking at co-designing with people from multiple intersections. Now we do it because that's just who we are. And it's also a great risk sort of assessment in terms of how do we make sure we don't miss out on what people need? And then being able to look at what's the multi-access design. So instead of just saying, right, everyone can use a Google form, well, not everyone needs to do that. And as I mentioned before, you can call a participant and talk them through the answers. Creativity, intentionality, and being flexible from the start, knowing that you're just not assuming that everyone has access to technology, has the literacy rates required, has the digital literacy rates required. So definitely when you're talking about, new refugees moving to a country, they're not going to be familiar with a bus system. They're not going to be familiar with how to pay for a bus system or even have money to pay. So being able to include them in the process and taking the design out to the community is going to highlight and uncover all of those barriers to participation, right? So in this regard, you're talking about intake processes and work that we've done looking at young mothers or pregnant women approaching abortion centers in Cambodia. Quite often there's a huge stigma. And our client would always think that the first point of stigma came once they got to the reception clinic. When you co-design with participants and users, the first point of stigma is actually the security guard at the front, who is most often male. So these things don't get uncovered by purposefully and intentionally co-designing with communities. Now, this next one really, again, talks about, let's come back to the budget. Can you incorporate an interpreter into your budget? If you're applying for funds, incorporate it. If you don't have anyone that requires an interpreter, then go back and tell the foundation or the funder, look, we didn't use this, can we reallocate it? But if you don't include it up front, then you're excluding people intentionally. So I won't cover these reasonable accommodations on the bottom because we've already talked about that. When you look at inclusive decision-making, I purposely haven't included frameworks here because they get very technical and take a lot of time, when a lot of it is really just common sense. Once you embed it in, you're looking at structured processes that actively seek intersectional perspectives. Now, for me, across my two ventures, we have same-sex attracted individuals, we have Indigenous community representation, we have people with physical impairments, and we have people that identify with hidden disabilities. When we talk about meetings, we're not going to say, okay, you from the minority, it's your turn to talk. What we're looking at is we use these voices in the room to identify where we are missing for particular communities, but they will also help us identify checkpoints. Okay, so that we can then say, okay, what are we missing? What else do we need to include for a budget? Now, this could be something as small as, you know, the client thinks that everyone lives in a city in Battambang, but Battambang itself is a province in Cambodia and they live an hour and a half away. So we redesign our project when you realize that most of the participants live in a small town. So then we have to increase our transport budget. So when you ask that, it's saying, well, what's the impact? We can't expect 12 women to try and coordinate transport from a rural area into the city once every 2 weeks. So we suck it up, to use a term, and we go to them. It's not hard. It just means, okay, so we don't have the comforts of the $25 hotel. We're in a ratty one that's $15, but that's what we do. How can we check ourselves to make sure that we're doing it? Okay, what is the impact of our decisions? And all of that is ideated using empathy before. And if we're not sure, we're making too many assumptions, call someone, phone a friend, phone a user with a lived experience, to use a technical term. Okay, but build that in. So ask them, what do you need to participate? Do you need large print? Yes, no. Sometimes, do you even have access to power? Well, we're not bringing the projector then. Looks like we're going back to the markers and the big pieces of paper. But it all comes down to intent and asking. So how do you lead in this regard? Well, we've probably talked about this a lot on the previous two slides. Intersectional curiosity. This is a culture that you build in your teams. Now, particularly if you're working in cultures that are hierarchical, patriarchal, with a hint of rote learning thrown in for good measure. A lot of our time spent with teams is building in curiosity, building in permission to ask questions, and educating our team members that if you don't ask questions, we're probably going in the wrong direction. Now, that also means asking questions to participants. So how might this impact different identity combinations? Women, rural areas, limited education. Okay. We make the decision-making systems visible. Everyone knows when we're around the table, and everyone knows that we don't run a program until we've double-checked that with the community that are attending. So how do you put that into meetings? Before we decide, what intersectional perspectives haven't we considered? Now, this is not saying, okay, out yourself. It's saying use empathy. You know, for me personally, I have elderly relatives, I have same-sex attracted relatives, I have relatives with disability. It's not hard to be human and use empathy to test those assumptions and get them validated. So it shouldn't be so hard to put an extra minute in a meeting in program design and say, what are we missing here? And you build that into the process, and very soon it just becomes common. It's not an outlier, it becomes the norm. And that's what we should be seeking for, not just as organizations, but our advocacy and agitation for systems change as well. Inclusion should become the norm. So when we do this, we send meeting agendas earlier. As you know, we're probably time poor. We can't always win at that. But it means that there's clear objectives. It allows people to process information in their own time, in their preferred format. Again, use multiple communication methods, verbal discussion, using a chat function, written responses. Not everyone likes to talk as much as me. It's a reality that I have to face. Sorry, that's my Australian sense of humor, purely designed for Keisha. We talked a bit in our breakout room about trust, and also here. Trust begins to develop when people see their experiences understood and reflected. Now, that's just even me as a ginger right? As what we call my hair color, which no longer exists in Australia. I love watching footballers with the same hair color. I'm like, that guy's like me. Now, I'm very privileged, right? I'm white, cisgender male. But it also comes down to, what about when you can't see things? And for the last 8 years, we've been embedding imagery of women entrepreneurs with disabilities in all of our material, not just because that's our primary focus, but we encourage other people to do it too, because the power of that identification is so strong in building trust and seeing that representation. And for us, purposely developing modern looking role models in the imagery is what allowed us to recruit more women. Because then they also talk to women that have participated in our programs and they double check, like, who are these people? So consistently following up on that. You can't just run one program. And this is where I've been really impressed with Market Impact Hub Asia Pacific. You know, when we train their team to look at inclusive programming in Nepal and Bangladesh and Shanghai, they're making a commitment. They're not just, okay, we're just going to do this one time. Their team actively looked at how can they embed inclusion across each of their organizations. Now, that could be, and this is what's really important, each one of those country offices had a different approach, absolutely perfect, because they have different barriers. They have different ecosystems. So being able to consistently look at inclusion in your own environment is very, very important. Now, that's also important for funders that are funding across boundaries and borders, because ecosystems and the built environment is different in every area. So anyway, how do we build that trust? Multiple feedback channels. It can be formal, it can be informal. Clear timelines for addressing concerns so that people don't feel like they've been forgotten. Okay, I know we've run over time by about 10 minutes, but the one thing I'd ask for you to look at now, if you can give us another 10 minutes, if you could redesign one program component with what you've just learned, what would it be? And you don't have to answer all three. This is you choose which one you want. What's one accommodation or flexibility you could pilot this month? But the biggest question is, how would you know if what you're implementing is actually working? So Pop and Vanita are going to take us out into breakout groups again to have this discussion. And then we'll all come back and we'll talk about this and then hopefully wrap up not long after that. As always, the slides are available. They'll be sent out to you. You can contact the Andy team or myself or Shanghai directly if you have additional questions. We're all heading in the same direction. We all believe in inclusion as the norm rather than the afterthought. So as a sort of quick wrap from me, we're happy to have you on this journey and always happy to share. So please share what you can in the next breakout session.
Thanks, Ian. Hi, all. We are going to start a breakout room. To keep to the time, they will automatically close after 10 minutes. Ian, I will add you to the first room and Shamha to the second room as always.
Cool. Welcome back, everyone. I hope you get comfortable as you all return to the room as we wrap up the final 5 minutes of the first session of the Access and Opportunity Lab. Before I hand over to Vanita and Pop to give the closing, I think we've got a few more people coming in here. I just wanted to provide one more anecdote. I think the key words we're looking at here are intentionality, creativity, and that commitment to at least try. And also when we're concerned about budgets. We realize that with a lot of rural communities and definitely with entrepreneurs with disabilities or looking at creativity from farmers with disabilities, they're all very shy. Just because you have a disability doesn't mean you know everyone in the district. So when we delivered this program, we had a series of games of getting to know you, but we also wanted feedback, of which, you know, people aren't used to having their voices heard can be very shy. So it's, and they're with low literacy, they're not going to fill out a form, they're a bit worried. A little bit of creativity and working with the community to identify it, the way that we got our feedback. We found 5 jars and we printed the 5 levels of smiley faces from sad face to super happy face. And then everyone got a piece of macaroni, dried pasta. Now, the voting, the feedback voting wasn't an area where we necessarily looked at it. It meant that a person could go there, place their own private vote and walk away. It's not like they're writing their names on the macaroni, completely anonymous. But what it meant for us was they're included, they felt included, they didn't feel this obligation or a shame or shyness. And all we had to do was count how many pieces of macaroni were in each jar. Cost effective, simple, creative, and intentional, and inclusive. So on behalf of Shama and myself, and definitely Vinaya from Inclusive in providing content, I want to thank Andy, Pop, Vanita, and Suchi for making all of this happen. So I'll hand over them for a closure.
Thank you, Ian and Shamha, for this wonderful session. And I hope to the participants, thank you all for staying up for like nearly 2 hours. We know it has been a long, and as Ian and Shamha indicated, it's a complex topic. We have probably scratched the surface. So we hope that all of you will join us for the next session, which will be more practical tips. We are not doing this access and opportunity learning for sort of just lectures. Our hope is that you will take away and you will implement, and changes will happen in your organization and you will spread the word. We'll also share relevant resources with you. And please feel free to share your feedback in the feedback form. That link I have shared in the chat box. We will try and incorporate them. We will definitely try to do better. If you feel duration is long or any other suggestions, any other recommendations that we can do to make this better. Also, if you have, as Shamha indicated in one of the breakout rooms, if you have any specific request, if you could email it to us, we can circulate it among the wider Andy community. I mean, we may not always get the answers. At least you will have more people thinking about the answers along with you. Once again, thank you so much, Shamha and Ian, and all of you here. Pop, anything you would like to add?
No, thank you. Nothing's for me. Smita, just again want to thank everyone for making your time, to join the first sessions, and we are very much looking forward to seeing you all again in our next session.
Thank you.
Thanks, everybody.
Thank you very
Enjoy.
much. Have a good day. Bye-bye.
Thank you.
Bye.
Thank you. Bye bye.
Bye. Benita, do you